What's up guys, Rolandas here. Just a quick video to answer a quick one question that one of the guys commented under my last video. Do you know how long a hair transplant can last? At least most of it. Does some of the hair transplant hair fall after 10 years? And can I get one done with never taking any finasteride? So it's an interesting question. I've seen it like pretty much every day. People are asking how long it lasts. There is no specific answer for this. It all depends on your family history basically and your like final Norwood pattern. So usually in FE they taking hair from the donor zone, and if you look, let's say on the side, they taking way above the safe zone. If you imagine Norwood 7 and his remaining hair, that's like the safest possible basically zone for extractions. But in the standard FE, almost always they're gonna be going beyond that area. So it's important to understand what's your family history if you have, if you are prone to be in Norwood 7 or even Norwood 6. So if there is no issues in your family, let's say everyone is like the maximum Norwood level in your family is Norwood 5 only or Norwood 4, there you should be good. But it still can happen. So a good surgeon always gonna assess this and assess your donor area, and depending on your age and everything, he gonna like know how far he can spread the extractions. Also worth mentioning that there is still miniaturization happening in donor area regardless if you're losing hair or not. Even people that have no hair loss still have a little bit. The normal amount is between 1 to let's say 10% of miniaturization happening in the donor area. That's normal. I remember I've been assessed by Dr. Bisang and Dr. Rupal Lupanzula, which both said that I have less than 10% miniaturization donor, which is great. That's absolutely normal. And Dr. Rasman, he studied like quite a lot about it, and he said many times that even people that don't have any hair loss, they still have miniaturization happening all over the scalp and in the donor as well. But it's such a small amount that you will never notice with the naked eye. So it's worth noting that that's normal, and if someone gonna take the hair from the permanent zone and transplant there is still such a small chance that like 1 or 2 grafts gonna miniaturize, but again, that's not a big deal. Also, another thing that I forgot to mention is a thing called DUPA, which stands for diffuse unpatterned alopecia. You have a miniaturization all over your scalp, just like I said before, and in the donor as well. But normally when you have more than 20% of miniaturization, that's when it's called DUPA. It means it's quite a lot, and it means your donor is unstable. Usually these kind of people are not a good candidates for surgery. I've seen Dr. Lorenzo having quite a lot of success actually with DUPA, and as far as I know, he's basically prescribing them the same treatments, finasteride, minoxidil, and keeps the patient for like at least a year or so and monitors and to see how if he is recovering or not, if it's stable or not. And sometimes the hair transplant is appropriate to do in such cases. But again, DUPA is not quite common, and usually it's quite easy to spot it. So if you see like you have overall a lot of miniaturization in your donor, it's pretty thin, that's when you can say, okay, I'm probably have DUPA. But if it looks something like mine, there is no clear sign that there is DUPA at all. And the last part, can I get it done with never taking any finasteride? Yes, it's possible, but again, it all depends on your like family history basically. So if your like a last final pattern gonna be Norwood 3, like there is what's the point in my perspective? What's the point to even take finasteride? Just cover the balding area, and if you're not gonna recede any further, that's it. You all set. But of course, there's always gonna be chances and possibilities. So most of the surgeons always gonna advise you to go on the finasteride just to kind of prevent, worst case scenario, just in case. Short answer: no, you don't have to take it. It's possible to keep it, but every situation has to be assessed properly by a good surgeon in order to suggest such a treatment. So I would suggest to speak to the good surgeon about it. Hope this video gonna be helpful for some of you guys. Like, subscribe as always. Thanks so much for watching. I'll see you in the next one.